Hello, everyone. Good day. We are the group 8, and our topic is about the cerebrospinal fluid. So, here is the outline of our topic. Please pay attention and listen because we will have a quiz at the end of the discussion. For the introduction, let us start first with what is CSF? So, cerebrospinal fluid, or CSF, it is a clear, colorless body fluid found in the brain and spinal cord. It circulates through the ventricles of the brain, subarachnoid space, and central canal of the spinal cord. Later, we will discuss about its components and its circulation. And so, what is its importance in the central nervous system? CSF has crucial roles in the central nervous system's protection, nourishment, and maintenance. CSF analysis alone seldom yields a definitive diagnosis. But when associated with history, clinical findings, and advanced imaging, it remains a valuable diagnostic tool for patients with signs of neurological disease. So CSF analysis, it needs to be in conjunction with other diagnostic tests to have a more accurate diagnosis. Because in some conditions, um, it can cause similar changes in the CSF. Like for example, elevated white blood cells in the CSF can indicate an infection like meningitis. And so it could also suggest an inflammatory or autoimmune condition like multiple sclerosis. It can even yield false positive or false negative results. And this can happen due to technical limitations, timing of the lumbar puncture, improper handling, or it can even vary among the response of our patient. And for some instances, a CSF abnormality might suggest a neurological disorder, and so we have to require doing diagnostic imaging, for example, for us to locate the lesion or to confirm our diagnosis. So, where is the CSF produced? CSF is produced in the choroid plexus in each ventricles. So later on in the next slide, we will discuss about the ventricles. The choroid plexus acts as a barrier in the brain separating the blood from the CSF, or also known as the blood-CSF barrier. The choroid plexus consists of a network of capillaries covered by specialized ependymal cells. So these ependymal cells, they are actually the lining of the ventricles in the brain. The ependymal cells of the choroid plexus, they actively secrete CSF by filtering blood plasma. They selectively transport to help maintain the proper ionic balance, which is necessary for neuronal function of the brain. And this includes the selective transportation of ions such as sodium, potassium, chloride, bicarbonate, and water and nutrients across their membranes, thus creating the CSF. So, for the ventricles of the brain, we have to familiarize ourselves with this because these ventricles are the home of the choroid plexus, where CSF is formed. So, for the lateral ventricles, this is actually bilateral. It consists the first and second ventricle. So there are two lateral ventricles, one in each hemisphere of the brain. They are the largest ventricles and are located within the cerebral hemisphere. Next is a third ventricle, which is a narrow ventricle cavity located in the midline between the two halves of the thalamus. It connects the lateral ventricles via the intraventricular foramina. And lastly, we have the fourth ventricle, which is located between the brainstem, specifically the pons and the medulla oblongata, and the cerebellum. The third ventricle, it connects to the fourth ventricle via the cerebral aqueduct. So we are now familiar with the ventricles of the brain. So we can now move on to the circulation of CSF. So we actually have numbers 1 to 8 in the diagram. For the number 1, CSF is secreted by the choroid plexus in each lateral ventricles. Second, the CSF flows through the intraventricular foramina, or also called as the foramina of Monro, into the third ventricle. So for the third step, choroid plexus in the third ventricle, it adds more CSF. So for the next step, number 4, the CSF flows down the cerebral aqueduct, or also known as the aqueduct of Sylvius, to the fourth ventricle. And then the choroid plexus in the fourth ventricle, it adds more CSF again. And then the CSF flows downwards through two lateral apertures, which are the foramina of Luschka for the lateral, and for the median aperture, the foramen of Magendie. After that, the CSF fills the subarachnoid space and perfuses external surfaces of brain and spinal cord. So the it goes through the subarachnoid space, which is the light blue here in the diagram. And from there, lastly, at the arachnoid villi, the CSF is reabsorbed into venous blood of the dural venous sinuses. So these are the steps of the circulation of the CSF in our brain and in the spinal cord. So what are the normal components of the CSF? We have the water, which provides a medium for the diffusion of nutrients and waste products. We have the proteins, such as the albumins and immunoglobulins. We have the glucose, which provides an energy for the brain, energy source of the brain. We have the lactic acid, urea, sodium, which is the most abundant ion in the CSF for maintaining osmotic balance, potassium, which helps in maintaining the resting potential of the neurons. We also have the magnesium, which is involved in the enzymatic processes and neuronal function. And for the calcium, it is involved in the neuronal signaling and muscle function. We also have chloride and bicarbonate, lymphocytes and monocytes. So lymphocytes, primarily the T cells, are present in the CSF to monitor for pathogens or abnormal cells. They play a role in recognizing and responding to infections such as viruses, bacteria, or fungi that might, invade the CNS. And for the monocytes, these are, as we all know, a type of white blood cells that can differentiate into macrophages or dendritic cells. And in the CSF, monocytes can help in detecting and responding to pathogens, and they can also aid in clearing out debris or damaged cells. So we have to take note that CSF normally does not contain erythrocytes. They're usually absent because if they are present in the CSF, it means that there is a hemorrhage or there is a traumatic tract. Next, to take note is that the major protein in the CSF is the albumin. The major immunoglobulin in normal CSF is the IgG. So IgG is the most prevalent antibody in the CSF, and it plays a significant role in immune surveillance and response within the CNS. Neutrophils are rare under normal conditions because um, If it is present, it means that there is an indication of infection or inflammation if it is present in significant numbers. So, normal CSF glucose level is 60 to 80% of the blood glucose concentration. So, these are the normal components of the CSF. For the functions of the CSF, first, it serves as a mechanical cushion to the brain. It absorbs shock and it protects the brain and spinal cord from injury due to sudden movements or trauma. Next, it is important in nutrient transport. CSF transports essential nutrients such as glucose, amino acids, ions, as mentioned from the previous slides, because uh, it supplies these nutrients to the brain and spinal cord. These nutrients are necessary for the energy metabolism and proper functioning of proper functioning of neurons and the glial cells in the brain. Next, it facilitates in removal of waste products. So CSF facilitates the removal of metabolic waste products such as carbon dioxide and lactate from the CNS. It also helps clear away potential harmful substances and debris, including amyloid beta proteins associated with neurodegenerative disease. Next is the regulation of homeostasis. CSF helps maintain a stable ionic composition, which is critical for proper neuronal function and synaptic transmission in the brain. It balances the concentration of electrolytes like sodium, potassium, and chloride. It also plays a role in regulating the pH of the CNS, which is very crucial for enzyme activity and neuronal function. Next is for the immune barrier function. CSF, it contains a small amount of immune cells and antibodies, which plays a role in detecting and responding to infections or other pathological conditions within the CSF. Within the CNS, I mean. And for the barrier function, while allowing certain immune components into the CSF helps prevent the entry of potentially harmful substances and pathogens by maintaining the integrity of blood-brain barrier. And lastly, for the intracranial pressure regulation, cerebrospinal fluid, it helps to maintain consistent intracranial pressure by circulating within the ventricles and subarachnoid space. And changes in the cerebrospinal fluid volume can compensate for fluctuations in blood volume or brain tissue volume, helping to prevent dangerous increase in intracranial pressure. So these are the functions of the cerebrospinal fluid.
Hello everyone, my name is Bianca Beltran and I'm going to discuss about the CSF dynamics. First is the formation of CSF. Several hypotheses have been offered to explain how CSF is created. According to the classic hypothesis, the choroid plexi are the principal source of CSF generation. It forms when the ependyma protrudes from the pia mater into the lateral, third and fourth ventricles. In this picture, we can see the schematic overview of the cerebrospinal fluid system. For this picture, a single layer of epithelial cells residing on connective tissue, the basement membrane, and fenestrated capillaries makes up the plexi. The underlying fenestrated capillaries are rather leaky, while the epithelium layer is relatively tight due to the tight junctions connecting the individual cells of the epithelium. This makes it possible for substances to go from the blood to the epithelial cells. For this image, as what we said earlier, CSFs are formed by ependymal cell in the choroid plexus And these ependymal cells have the tight junction and play a very important role for the formation of CSF. Capillary in choroidal plexus have fenestrated, so they don't have the blood-vein barrier, so the fluid can be moved easily from capillary to outside, but these ependymal cells have the tight junction, this one, so only selective molecules can pass through and form the CSF. Also, CSF is the filtrate of ependymal cell or epithelial cell. So for the next slide, let us see what are the transport mechanism in the epithelial cell that occurs during the formation of CSF. Here we have the blood capillary or fenestrated capillary. These are the tiny blood vessels that contain the pore, or also known as windows, which increases the flow of nutrients, waste, and other substances. As endothelial cell has the pore, they don't have the blood-vein barrier or the tight junction. And as we see here, this is the choroid epithelial cell. It has two surfaces, which is the basal surface and the apical surface. In basal surface, the villi are absent, and in the apical surface, the villi are present. For the transport system in basal surface, the antiport system, this is the exchanger of the two molecules moving in opposite directions across the cell membrane. So sodium is taken in, at the same time hydrogen ion is taken out. In a similar way, bicarbonate is taken inside the cell, and chloride is taken out by the exchanger or by the secondary active transporter. Another transport system here is the symport system. This is the integral protein. It allows two molecules to move in the same direction across the membrane. Here, the molecules are the chloride and the sodium ion. The bicarbonate is formed from the carbon dioxide, and it is coming out from the metabolism of the cell with a combination of water. This is the water. They form carbonic acid and bicarbonate as a result of transportation. For the transport system in apical surface, we can see here the sodium-potassium pump or the sodium-potassium ATPase. Their function is to take 3 sodium out and 2 potassium in, as the sodium is out and accumulating in the space. So the sodium concentration is also increasing because of this pump, and remember that the water always follows the sodium. So the water is drained to this area because, as what we said, sodium water always follows the sodium. As the sodium concentration is increasing, the positive ion is also increasing. To neutralize the positive ion, chloride will move to this area to neutralize the positive ion. And this is how the CSF are formed by these components. For the absorption, several anatomical sites are responsible for CSF absorption, like arachnoid granulations, meningeal lymphatics, and cranial nerve sheaths and nasal cribriform plate to the cervical lymphatics. To summarize the classical hypothesis of CSF absorption, it occurs from the subarachnoid spaces into the lymph system via the nasal cribriform plate and perineural sheaths, and from the subarachnoid spaces into the venous blood system via the dural venous sinuses and via cranial arachnoid granulations. For the waste elimination, the transportation of nutrients and elimination of waste items are two of CSF's primary roles. The lymphatic system is the waste elimination mechanism that has been suggested most recently. Through processes such as the AQP4 water channels at the astrocytic end feet, the CSF penetrates the brain parenchyma from the perivascular spaces surrounding arteries. CSF diffuses and combines with waste products and interstitial fluid within the brain parenchyma. Through pathways such as AQP for water channels. The mixture of CSF, ISF, and waste materials penetrates the perivascular regions surrounding veins. The mixture exits the brain parenchyma via the perivascular spaces. For the factors influencing CSF dynamics, there are two, which are the endogenous and exogenous. For endogenous, there are choroid plexus ischemia, CSF pressure. For example, high pressure can be associated with brain disorders like brain tumor, meningitis, or encephalitis. This kind of disorders can affect the CSF pressure. There are also hypoxia, acidosis or alkalosis, hypoglycemia, and neura. For exogenous, acetazolamide, furosemide, amiloride, omeprazole, glycosides, and cholera toxins. And now let's go to diagnostic importance of CSF. For the CSF sampling, or lumbar puncture or spinal tap, it takes place in the lower back, namely in the lumbar region. It involves inserting a needle into the gap between two lumbar bones, known as vertebrae, and then a sample of cerebrospinal fluid is taken. A typical lumbar puncture generally collects about 10 to 20 ml of CSF, which is sufficient for the wide range of diagnostic tests. So, why are we doing lumbar puncture? It is to diagnose infections, inflammation, and other illnesses, determine the pressure of cerebrospinal fluid, inject spinal anesthetics, chemotherapy, or other drugs, inject dye known as myelography into CSF to get diagnostic images of cerebrospinal fluid flow, or radioactive substances known as cysternography into the fluid. Lumbar puncture can help diagnose severe viral, bacterial, and fungal infections that can cause syphilis, encephalitis, and meningitis. Subarachnoid hemorrhage or bleeding around the brain, some brain or spinal cord tumors, a certain inflammatory neurological disorder like Guillain-Barré syndrome and multiple sclerosis, neurological autoimmune diseases, and dementias such as Alzheimer's disease and others. For the common diagnostic tests of CSF, we have the cell count. It identifies and measures the CSF's red blood cells and white blood cells. The normal range for white blood cells, 0 to 5 cells per microliter, all mononuclear. For red blood cells naman po is normally absent siya. For the clinical significance, increased white blood cells in the CSF could indicate a tumor, abscess, demyelinating disease like multiple sclerosis, meningitis, acute infection, or the start of a long-term sickness or chronic. For the red blood cells in the CSF sample could indicate a traumatic lumbar puncture or be an indication of bleeding in the spinal fluid. For the CSF appearance, the normal will be water-like, colorless, and transparent. When it comes to clinical significance, cloudy or turbid, may be entirely opaque or only slightly hazy. Possible causes po may be bacterial meningitis or high protein levels. For xanthochromic CSF, discoloration that is yellowish, usually seen during centrifugation. Possible causes naman po is subarachnoid hemorrhage, old hemorrhage, and elevated protein levels. For bloody CSF, it is red or pink CSF, suggesting that blood is present. Possible causes, subarachnoid hemorrhage and traumatic tap. For oily or viscous CSF, viscous, oily, or thick texture, possible causes might be high lipid content and choroid plexus papilloma. For frothy CSF, frothy or foam appearance when collected, possible causes may be high protein levels. For milky CSF, milky or opalescent and may resemble diluted milk. Possible causes might be chylous effusion, meningeal carcinomatosis, and infections. For protein levels, it is to calculate the CSF's total protein content, which represents both intrathecal protein synthesis and the blood-brain barrier's permeability. For normal range, 15 to 45 mg per deciliter. For clinical significance, increased CSF protein levels can be caused by blood in the CSF, diabetes, polyneuritis, tumor, injury, or any other inflammatory or infectious illness. Decreased protein levels indicate rapid CSF synthesis or protein loss throughout the body. Glucose levels measure the glucose concentration in the cerebrospinal fluid and compare it to blood glucose levels. For normal range, 40 to 70 mg per deciliter, typically two-thirds of the plasma glucose level. For clinical significance, increased CSF glucose is indicative of elevated blood sugar or hyperglycemia. Decreased CSF glucose can be caused by hypoglycemia, low blood sugar, bacterial or fungal infections such as meningitis, tuberculosis, or other kinds of meningitis. For cultures, it detects the presence of bacteria, fungus, or other microorganisms in CSF. For bacterial culture, detects bacterial infections include Streptococcus pneumoniae and Neisseria meningitidis. For Streptococcus pneumoniae is a gram-positive bacterium that causes meningitis in adults. For Neisseria meningitidis is a gram-negative bacterium that causes meningococcal disease that affects all ages, including the healthy young adults, and causes bloodstream infections. For fungal culture, identifies fungal illnesses, including cryptococcal meningitis that causes by Cryptococcus neoformans. It is a gram-negative fungus that is commonly found in bird droppings. If inhaled, the spores can grow and move from the lungs to the membranes that surround the brain or spinal cord, resulting in meningitis. For clinical significance, positive culture confirms the presence of an infectious bacterium and directs specific antibiotic treatment. For negative culture, prior antibiotic use, viral infections, or non-infectious causes of symptoms may all contribute to this. For the interpretation of abnormal CSF findings, for bacterial meningitis, the WBC count, typically above 100 cells per microliter, primarily composed of neutrophils. This demonstrates a robust immunological response to a bacterial infection. RBC count, absent and no bleeding in CSF. For protein levels, due to the breakdown of the blood-brain barrier and the presence of inflammatory proteins, levels are markedly raised, frequently exceeding 100 mg per deciliter. For glucose level, as bacteria eat glucose, causing levels to fall to less than 40 mg per deciliter. For CSF appearance, the fluid is opaque or purulent, indicating the presence of pus and a high concentration of cells. For additional findings, cultures of the CSF typically develop a specific bacterium, confirming diagnosis. Viral meningitis. For WBC, elevated ranges from 10 to 100 cells per microliter with lymphocyte predominance, indicating viral infection. For RBC count, it is absent. Protein levels are mildly raised, often below 100 mg per deciliter due to inflammation. For glucose levels, normally or slightly lowered because viruses, unlike bacteria, do not require glucose. For CSF appearance, the fluid remains clear because there is less cellular debris than with bacterial meningitis. For additional findings, cultures are typically negative for bacteria, but PCR testing can detect particular viral infections. Subarachnoid hemorrhage. For WBC count, slightly higher due to the potential for a modest inflammatory reaction from blood in the CSF. RBC count high, not falling in later tubes, suggesting a real hemorrhage instead than a painful tap. Protein levels, blood proteins cause the protein levels to be elevated. Glucose levels, Blood doesn't directly affect glucose metabolism, hence glucose levels are usually normal. CSF appearance: initially bloody, the fluid may turn xanthochromic or yellowish during centrifugation, showing older blood breakdown products. For additional findings, xanthochromia is a crucial marker for distinguishing subarachnoid hemorrhage from a traumatizing TAP.
Hi, I am Gonzaga, and let's move on to CSF related disorders. So I have here the three common related disorders of CSF, and the first one is hydrocephalus. It is a condition which is the excess cerebrospinal fluid ay nagbi-build up or naiipon sa ventricle ng brain, kung saan nagkukos ito ng pagtaas ng pressure and can damage neurological. The symptoms are enlarged head, seizures, poor coordination, vision problems, and development days. The next is the treatment. We can use diuretics, specifically acetazolamide and furosemide. This medication is to temporarily reduce the CSF production. Next, we have the surgical intervention, in which we will use a shunt. A shunt ay isang hollow tube that is surgically placed in the brain to help drain cerebrospinal fluid and redirect it to another location in the body, such as abdomen, where it can be reabsorbed. The next in CSF related disorder is CSF leaks. It occurs when cerebrospinal fluid escapes its usual place through a tear or hole in the membrane surrounding the brain or spinal cord, kung saan ito ay karaniwang nagdudulot ng pagbaba ng intracranial pressure. The symptoms of CSF leaks are headache, fluid leaking in nose or ears, dizziness, balance issues. For treatment, we can use acetazolamide as medication. And for surgical intervention, we will use a patch called epidural blood patch, kung saan kukuha tayo ng blood from the patient and i-inject ito sa part ng hole or tear kung saan naglilik ang cerebrospinal fluid, then magpo-form ito ng clot which acts as a patch. Lastly, in CSF-related disorders is meningitis. It is a serious disease in which there is inflammation of the meninges. Meninges is protective layer covering the brain and spinal cord. And usually, meningitis caused by viral or bacterial infection. The symptoms of meningitis are fever, severe headache, neck stiffness, nausea, vomiting, and sensitivity to light. The treatment we can use for bacterial infection is antibiotic therapy, and for viral infection is supportive care, rest, and pain relief. Also, we can use corticosteroids and anticonvulsants. Moving on to therapeutic application of CSF. One of the most common therapeutic application of CSF is the intrathecal drug delivery. So this method involves injecting medication directly into the CSF, allowing it to reach the brain and spinal cord more effectively. It's particularly useful for treating conditions like chronic pain, where medication such as morphine can be delivered intrathecally to manage severe pain. And by ensuring higher concentrations of the drug reach the target area while minimizing side effects, intrathecal drug delivery provides a targeted and effective treatment option for various serious conditions.
So today we'll talk about the advances in cerebrospinal fluid research. So one of the research in 2024 is about the canine cerebrospinal fluid analysis using two new automated techniques, the Sysmex X and V body fluid mode, which is an instrument that designed for analyzing a range of body fluids, and also an artificial intelligence based algorithm, which is the Olympus AI algorithm. So this technology employs artificial intelligence to detect and categorize different cell types on a scan slides of the CSF. So traditionally, the analysis of CSF requires manual cell counting and classification. With these two new methods, we can count cells faster, although the Sysmex X and V could effectively count total cells. However, it needs further improvements and a little bit of tweaking because it cannot consistently classify cells accurately. So with the Olympus AI algorithm naman, it accurately identify and classify different cell types, but it still need a refinement. Both two need refinement to ensure full reliability. So another one is a research from 2023 by Han et al., a minimally invasive method for serial cerebrospinal fluid collection and injection in rodents with high survival rates. So, uh, in this research, they found out that you can actually use a 30 gauge needle and bend the needle tip 90 to 110-degree angle. So with the mice, it should be 2 to 3 millimeter long, and for the rats, it should be 4 to 5 millimeter long. So the researchers can access the CSF without making surgical incision, and it reduces animal stress and simplifies the procedure. The procedure is done in the animal under anesthesia. It is punctured vertically at the back of the foramen magnum. And this minimal invasive and cost-effective method allows for repeated sampling from the same animal and can facilitate long-term studies of disease progression and therapeutic responses. It also supports various types of analysis and enables multiple drug administration, making it a valuable tool for advancing neuroscience research. Another one is about new frontiers in diagnosis and therapy of circulating tumor markers in cerebrospinal fluid in vitro and in vivo. So, this research found out that a potential future method involves using the GILUPI cell collector. It is a device that captures cancer cells in blood, but its invasive nature and limited effectiveness for CSF make it less appealing. A new research also suggests that cancer cells exchange between CSF, blood, lymph, and brain tissue. So, testing these cells in multiple fluids could improve the accuracy of developments, including integrating real-time molecular diagnosis with targeted therapy using platforms like photoacoustic flow cytometry. So this technology can identify and destroy single cancer cells in blood with light and sound. Applying this to CSF could potentially prevent cancer from spreading to the brain. Additionally, advanced nanotechnology holds promise for targeted drug delivery. Nanoparticles could be designed to cross the blood-brain barrier and deliver drugs precisely to tumors and track treatment progress. Innovative nanoparticles like those with dual imaging and therapy capabilities or those combined with targeting agents are being explored to enhance treatment effectiveness and monitoring. So, for our conclusion, our cerebrospinal fluid or the CSF is a clear fluid that surrounds and protects the brain and the spinal cord. So, it is produced in our brain ventricles and they flow through them, helping cushion the brain, transport nutrients, remove waste, and regulate pressure. So, CSF analysis is, crucial for diagnosing various neurological conditions when combined with other tests and imaging. And for the diagnostic purposes, A lumbar puncture or spinal tap is performed to collect CSF, which can reveal infections, inflammation, tumors, and other disorders. So, abnormal CSF findings can indicate issues like infections, bleeding, or diseases such as multiple sclerosis. Our CSF also has therapeutic uses, including the CSF shunting to treat hydrocephalus and delivering medication directly into the CSF to treat central nervous system conditions. So overall, CSF plays a key role in both diagnosing and treating neurological diseases. And that's all. Thank you. So let's proceed to our quiz.